Come on in.
Hi, I'm Christina. I'm going to be your student nurse today. I'm going to be doing a head-to-toe assessment, which is a little bit more in-depth than just doing some vital signs. Can I verify your name and date of birth, please?
C Floyd, 21077.
Okay, great. So what I'm going to do now at this time, I'm going to go ahead and wash my hands and we'll go ahead and get started, okay? All right. So at this time, I'm going to go ahead and provide privacy for the patient. If I had a door or draw the curtain rod thing. While I asked the patient about his name and date of birth, I noticed that he was dressed neatly. His clothes are not torn. They're not stained. His behavior is calm. He is slender, but seems to be healthy and not malnutritioned. And his speech was not slurred or stuttering at this time. So what I'm going to do is I'm going to wash my hands and proceed with starting with the head to toe and vital signs. I wash my hands and I'm going to place gloves on. While I'm taking a look at the patient, I'm going to make sure that he doesn't have any lesions or wounds. I'm also going to note if he has any drains or any ports that are in place as well. Let's see here. We're going to go ahead and do your blood pressure first. Now, normally, what is your blood pressure run? Do you know?
Somewhere around 120/80.
Okay, so you're around the normal range. I'm going to sit here next to you so that they can see what I'm doing. Okay, place your arm slightly this way. I'm going to check for his brachial artery, which is right there. All right, are you having any pain or any discomfort today?
No.
Okay. All right, if you'll just relax your arm for me, please. Okay. And he is around 120/82 on his blood pressure. All right. I'm going to take a look at your pulse rate, which is going to be on the radial side, and we're going to do it for 30 seconds. All right. So his pulse rate was 74, and I counted 6 breaths for 30 seconds, so that would have been 12. So let's see here. At this time, also, I would check for his oxygen saturation rate, which of course I don't have an O2 pulse meter for the digital finger, so but we would check for that as well. I have asked the patient, of course, about the nausea or discomfort. He said that he doesn't have any, so that would be a 0 out of 10. His level of consciousness at this time, he is able to speak to me, and he is aware of his surroundings at this time as well. I'm going to check for his eye movements and constrictions of the light and everything too right now. All right, so if you will turn facing towards me. All right, I'm just going to check to make sure that you don't have any breakdowns on the ears, and make sure that you don't have, okay. I'm going to check your sclera and your conjunctiva, which is pink and moist. All right. If you'll take a look at my nose for me, I'm going to take the light and shine it in one eye, come back around and shine it in the other. What I'm doing is checking to see if your pupils will contract equally. Good. Good. All right. If you will, take a look at the top of the pen for me, and as I move it, if you will, follow it. Come in towards your nose. All right. His eyes did react equally and equally on both sides. He was able to follow the light, the top of the light for me as well in every direction. So he is equal and good on both eyes. Let's see here. I did check his sclera and his conjunctiva. Everything looks good there. Now I'm going to check for his nares. I'm going to check for his oral, make sure that he is moist and pink there as well. You'll take a look up for me. All right, now look at me. Got eye.
Ah.
All right, you can stick your tongue back in. Open up one more time. All right. He doesn't have any sores. He doesn't appear to have any broken teeth or anything. His mouth is pink and wet. Now what I'm going to do is I'm going to check for his jugular veins, make sure there's no distension or throbbing. If you will, take a look up at the wall there. Okay, now take a look at the other side for me. All right, and those are fine. Those are not distended or anything. Now I'm going to check for hydration. So what I'm going to do is to check the skin turgor. So just going to pinch here slightly, and it bounces right back. So he is very well hydrated. Next thing is we're going to check for his breath sounds and the heart sounds. So, all right, if you want to turn just normal for me this way and then have a seat. There we go. Good. Take a deep breath for me. Let out. Take a deep breath for me. Good job. Take a deep breath. Good job. I'm going to go ahead and listen to his heart sounds at this time while I'm up here in the anterior area. You don't have to, just breathe normal. All right, here I'm going to have to listen to your apical pulse for 1 full minute, okay? All right, so his apical pulse was actually 65. All right, then I'm going to also listen to his breath sounds on the posterior side. Now, y'all may not be able to see where I am going to be placing the stethoscope, but I will be checking the 5 areas side to side on the posterior side, beginning up here, right above the scapula. Taking a deep breath for me. All right. So he is, both lungs sound great bilaterally on both sides, from the top lobe down to the bottom lobe. I also went ahead and checked his flanks while I was back there as well. I pressed in slightly, and he doesn't have any tenderness or anything. All right. At this time, I'm also going to check for his radial pulses to be equal on both sides. So if I can have both of your wrists real quick. Okay, both of them are equal and good on both sides. There is no irregularly. I'm going to check his arms to make sure that he doesn't have any edema, or check for also the temperature, which he is. They appear to be good. He is warm to, not overly warm to the touch, but he's normal to the touch, and he doesn't have any edema at this time. All right, so I'm going to go ahead and have you to lay down for me. With your, either way, it doesn't matter. this up. All right, so we're going to be checking the abdomen at this time. So I'm going to have you to, all right. I'm taking a look at the abdomen. He doesn't have any scars or anything like that. He doesn't have any distensions. There's no, and it's both equal on both sides. So there's no appearance of him having a hernia or anything like that. Now, have you had any surgeries in your abdomen area, sir?
I had 2 hernia surgeries.
Okay. So your scars are going to be the lower ones. Okay. All right. Those will, of course, be covered, so we're going to take a look at those. All right. What I'm going to do is I'm going to listen to your abdomen first before we move on to me actually pressing on the belly. When was the last time you pooped?
Today.
Was that earlier this morning?
This morning.
And was it normal?
Yes.
Okay, and when was the last time you urinated?
About 30 minutes ago.
Okay, and was it normal?
Yes.
All right. All right, he had bowel sounds in his right lower quadrant. I had 7. In the right upper quadrant, I had 8. In the left upper quadrant, he had 7. And then on the left lower quadrant, he had 7 as well. So he must have just got through eating something. What I'll do is I'll add all of those up and multiply those times 4, and then that will give me whether or not he is got hypoactive, or if he's hyperactive, or if he's just regular sounds. All right, so I'm going to press on your stomach a little bit. Just let me know if you have any discomfort or anything. And then I'm going to press down into the bladder area. All right. Everything okay on that end?
Yep.
All right. Let's see here. All right, I'm going to go ahead and move into the lower extremities to check for his range of motion and things like that, since I'm done with the abdomen area. All right. All right, yeah, they can see me still. All right, if you will, push up against, there you go. If you will pull, all right. We'll take a look at your toes. All right, those are equal. All right, we'll take a look at your legs. No edema there. No edema there. All right, if you will, lift this leg up for me. All right, now pull it towards you, like bending the knee. All right, bring it back down. Do the same on this one. Pull it, there you go. All right, range of motion is good on that area. Did it stop? No, it's still going. Okay. All right, you can sit back up for me. All right, and then I'm going to check on his grips and range of motion for the upper extremities as well. All right, if you will, grab my fingers, squeeze. All right, let go. Push up. All right, push down. All right, and take your arm, bring it up like this. Bring it right down. Put that on. All right, range of motion is good on his upper extremities as well. He's done so good about being real calm about this and not making any fun. They're gonna get a kick out of this video. His capillary refills are 3 seconds or less. So that means he has good circulation. I'm gonna think if there's anything else. Is it still going? Yeah, it's still going. I think that's it. All right, so everything looked like it was within normal range. Patient seems to have been cooperative. I do thank you for your time. Now what I'm going to do is I'm going to go wash my hands and document my findings. Thank you.